Hello and welcome back. This is Dr. David McFadden from the Dental Implant Center in Dallas, Texas. This is the continuation of our best cases, or I should say our most recent 25 cases, and this will be cases 11 through 20. So we'll get started, and like I said, many of my colleagues continue to insist that these FP1 or implant bridge cases are not predictably successful, and that they don't do them because there's too many variables to get it right. Many of them don't come out and say that. They just simply say that all-on-4 is the best treatment out there, which is absolutely not true. So by putting these 25 cases together, I wanted our viewers to see that this is what we do every day, every week here in Dallas. So I did want to mention the treatment time, and a lot of this has to do with complexity of the case. If you've got a straightforward case where you've got some or all of your teeth, you've got most of your bone, we can do the implants, all of the implants in the first surgery, and make you a temporary that same day. We can finish these cases in as little as 4 months. There's several factors that come into play about why it takes longer. The most common one is finances. Many of our patients, because this treatment is more expensive than all-on-4, and when you see these cases, you'll understand why. I'm about to do another video to explain how it is that we do these cases and why it takes so much more time and why the lab costs are more. But to most viewers that have been doing their research, just seeing these cases will explain to you why the treatment time is slightly longer and why it is more expensive. So the other variables other than finances, well, going back to finances, we allow people to pay as they go. It's not a payment plan, but you pay for each appointment as you go. So you can spread these treatments out up to 2 years sometimes, and sometimes even longer. The main factor there is if you're not breaking your temporaries, we've got the luxury of time. We can take our time, and people can pay on a slower schedule, I guess is the best way to say that. So some of these cases take 18 months just because they need so much bone grafting and so much healing time. But many of the cases that you'll see today and on the last video are because patients just wanted a little more time between appointments so they could earn more money or figure out the financing over a longer period of time. So shortest we can do is 4 months. Longest we can do, or the longest that we try to limit it to 2 years. But if you're not breaking your temporaries, which is not all that common, but many people who have been abusing their teeth for decades have trouble adjusting to the new arrangement. And the temporary teeth are a strong polymethyl methacrylate, which is a strong plastic polymer. If you could break your own enamel, obviously you can break plastic. So anyway, that explains this treatment time or range that I show you here. So let's move right on to case 11. Here's a patient who was trying to be treated at a Texas dental school, and it was taking so long that he couldn't stand to go with his denture any longer. He only wore it in public settings, so he came to us after his teeth were extracted, but he still had excellent bone, as you can see on this panoramic image. We're treating his upper arch and his missing tooth on the lower right. So the very first day of treatment, we place, I think it was 7 implants, and we make him this beautiful, well-contoured temporary. It goes in on these, I guess it's 8 implants. Only 7 of them were strong enough to hold the temporary that day, so you'll see an 8th implant on the right side of the screen that has a little cap on it, and that's because that one implant wasn't strong enough to support the temporary. This is what his tissues look like on the day of surgery. And I'm going to comment on these 10 cases. I'm going to comment today on part of why we get such great results is that we're extremely gentle. I do the surgical phase of treatment and my partners do the prosthetic phase of treatment. But I pride myself on being extremely gentle when I do surgery. I'm trying not to disturb the bone any more than I have to, and I'm trying not to disturb the soft tissues at all. In a case like this one, where there is no teeth, we have to make an incision and we have to part the tissues some to get the implants in there. But everything I do is slow and gentle, and I think that's why our immediate results are so good. This is literally the day that we placed his implants. You can see some stitches and some light bleeding, but all in all, it already looks like it's well on its way to healing well. So here he is after 3 months of wearing that temporary, and look at how beautiful his tissues are. And as I always point out, we were able to get some of the soft tissue architecture back that people have when they have teeth. It's the papilla, the little tissue between each tooth, that's so important to us. And I showed these pictures just to, again, show what's possible when you care about outcomes and you care about patients. Here's his final restoration with all the convex contours that you've heard me preach about. And here's his final restoration, his final implant bridge, or FP1, on the day of delivery. This is the day he gets the new teeth, and there's a little bit of pressure on those tissues to continue shaping them for the future. But this is the day he gets them. A month later, we haven't seen him back to get the final pictures, but a month later these tissues are going to look even better. So there's his final result, 8 implants, and we gave him back, I believe, 14 teeth, plus his lower molar. And there's his smile afterwards. He was from 2 hours outside of town. He came 3 times to Dallas. It drove here for the 2-hour trip. 5 months and 5 appointments. Again, for those of you who haven't seen the 1 through 10 presentation, for our out-of-town patients, which we are, I guess, quickly approaching 50%, we've piggybacked the middle phase of treatment so that we combine 3 appointments into one 4-day week that the patient stays for that 4 days to prevent multiple trips and multiple hotel stays. Case 12. Here's a person with what we call terminal dentition. Yes, they probably have 4 or 5 or so teeth that we could save, but like I've explained in the first part of this presentation, or the 1 through 10 cases, many times these teeth become problems within 10 years and we regret not taking them out. So I explain how we determine what teeth we save and what teeth we take out. Sometimes we do have to sacrifice good teeth for the greater good, but that is always the patient's choice. That is not my choice. I simply educate the patient and we make a decision together. So here's the panoramic x-ray, and again what I'm looking for is how much bone is around the teeth, how much bone is around in the areas where the teeth are missing, and this patient again has good bone. Again, my colleagues or my competitors are always telling patients you don't have enough bone for FP1 or implant bridges, and I mean, I don't know any other way to say it, but it's just a plain lie. 90% of the patients who come into this practice have enough bone to get implant bridges, and my colleagues or competitors tell them they don't. It's not very ethical. So again, first day we took out all of her teeth and placed this temporary. I've explained those holes in the front of the teeth. On the temporary, we don't have all of the abutment options we have for the permanent restoration. So every once in a while, if bone doesn't allow us to place the implant as far towards the palate as we would like, we put the screw holes go through the front of the temporary. We cover those up with a tooth colored material, but the final restoration, all the screw holes are behind the incisal edge of the front teeth. So here's a lady who may have been told by other doctors that she didn't have enough bone. Um, and I'm sorry, this is a gentleman. I don't know if he went for another consultation, but he had excellent bone, and we were able to put in 7 implants in the upper and 2 in the lower. Here's the temporary that he leaves with. And again, I'm going to brag about these tissues. This is the day of surgery. This is the same day that we took out 8 teeth, placed 7 implants in the upper jaw, and gave him this temporary. And it doesn't even look like he was in for a dental treatment. There's only some very, very light bleeding around the necks of some of the teeth. But if you treat the bone and the tissues with this kind of respect, the patient comes back in 2 weeks and their tissues look amazing. This is actually 3 months later. We checked most of our patients in 2 weeks if they're local. This gentleman was local, and we maintained all of his soft tissue anatomy because we shaped the temporary properly and we placed the implants properly. Here's his final restoration, same convex contours as I always talk about. And here's his final restoration. Again, I've kind of stopped saying this is as good as we've ever done, because this has now become our standard for most people with good bone and relatively good soft tissues. But we've maintained all of his soft tissue architecture. We didn't remove any bone in his upper arch, and this is what we expect to, the results we expect now all the time. Here's his post-operative panoramic image. And here's his before and after smile. Pretty transformative. This gentleman was local, so his total treatment took us 5 months. He had 5 visits. He may have had 6 with a short follow-up 2 weeks after the surgery. But we do try to piggyback 2 appointments in 1 day, even for our local patients. So he was here 4 or 5 times for this treatment. Moving on to case 13. Here's one of our biggest transformations. This gentleman's a retired physician, never had the time, or never felt like he had the time to get his teeth fixed until he retired. But today was the day, and he decided to move forward. And I'll just point out here, this gentleman always had red tissues. You can see from this picture, his tissues were always more red than most patients. And we reduced some of that, but a lot of this redness continued even after the final restorations. And I think that he just has a different pigment than the average dental patient. Here's his preoperative panoramic image, and you can see that he had 1 implant in the upper left, but he's got great bone, and his roots are long, which is always makes it hard for me to take them out, but his roots are long, he has great bone, he should have a great result. There's no reason to cut any bone away, and there's no reason to not have an outstanding outcome. So I talk a lot about these transitional treatments, and I just came up with this protocol about 4 years ago where I don't take all the teeth out at first. Prior to me starting this protocol, everyone in implant dentistry who was doing a full mouth or a full arch would take out all the teeth first, then hope you had enough implant stability to make a fixed temporary on the implants. Well, if we didn't, then all our bridges were burned and the patient had to wear a denture for 2 to 3 months afterwards. I didn't like that, and the patient certainly didn't like that. So what I do now is I leave a few selective teeth behind so that if the implant insertion torque is not high enough to hold an implant temporary, we put the temporary on teeth. And that's what we did for this gentleman. That's why you still see a few teeth left behind after surgery. So his first temporary is what we call tooth-borne. This 8-unit temporary goes on the 4 teeth that I left behind. This is what it looks like on the day of surgery. Again, I'd call that minimal trauma in spite of taking out about 10 teeth and placing several implants and doing a bone graft. Here he is 2 weeks later. A little bit of tissue retraction, which we always get a little bit of. That's why we don't make the final restorations until the bone and the gums have healed for 3 months. So you can see here his second surgical panoramic image. You can see that this is actually the day of surgery. We took out all but 3 teeth and left his 1 implant and placed 4 more implants, preparing for the next surgery. So at the next surgery, we take out the remaining teeth and place, in this case, just 1 more implant. Here's his final restoration. And the part on the very back right of your screen, that's a molar tooth that we call a cantilever ponic. It's 1 tooth extended off the back implant to give people 1 more chewing tooth. And we do this fairly often, and zirconia is so strong that we don't worry about a 1-tooth cantilever. They simply don't break, or I should say I haven't had any break in the practice. And again, I show you his tissues after he wore the temporary for 3 months, and they're still reddish, but they look outstanding. We've maintained all those little papilla, the gingival architecture that I'm so passionate about. We've maintained that, and this slide demonstrates that. Here's his final panoramic image. We started on his lower after his upper was finished. So on his lower, we took out all the teeth and placed most of the implants at the first surgery, and this is his surgical temporary. Here's the surgical temporary at the time on the day of surgery, and this looks a little more traumatized, I should say, but I've developed another protocol for the lower jaw where we don't remove any of the papilla. We let them heal. Anyway, it's too much to get into. I'll cover that maybe in a future video, but this protocol, it's a tissue manipulation and suturing protocol that has worked out really well for us. Anyway, it's the right thing to do for our patients. So because his molar sites were so large, I couldn't get an implant in the back right, which is the left side lower of this picture. So we let him wear that temporary for 6 months to let the sockets heal on the right side, and placed another implant at 6 months on the back right. And this is his final lower restoration. And again, notice the convex contours. Basically, we make it look like teeth. If you cut the roots off of a tooth, this is what a tooth or all the lower teeth would look like. Here's his tissues on the lower, and because of that technique of no tissue removal and the suturing that we do, he's got a really nice recipient site for this new implant bridge. Here he is with upper and lower finished. Anyway, again, I said in my first video, don't get too caught up in the color of the teeth you see on these cases. We honor everybody's request. If you want bright white teeth, that's what you'll get. Men, older men often want age-appropriate teeth or close to it. So there's a little bit of character in these that you may not want. That's the easy part. We look at a shade guide and you tell us what you want. And the lab that I've used for 34 years now, they're so good. They can add natural character to any color you pick. So anyway, this case for Richard is just amazing. Here's his post-operative pano. I guess he had 1 upper implant. We placed 5 more, and we placed another 8 lowers. So he has 13 implants holding these bridges. And there's his before and after smile. Again, it's always remarkable for me to see these when I go back to put the cases together. Because we did have a little delay between upper and lower arches, and he had that molar that had to heal for 6 months, this whole treatment took us 15 months. He came 10 times, and he was local. So we had a little delay at one point also where he had a bicycling accident, and we had to redo some work for him. So we could have done both arches at the same time and cut these times in half or less. Case 14. Another patient with rampant decay, many failing teeth, and the question would be, are there any ones we could save? And the answer would be yes. But when a person's mouth gets this far along with cavities, even if we save teeth, we see recurrent cavities within 5 years. And so the decision to take all the teeth out was made. This is the patient's preoperative panoramic image, and as you can see, there's excellent bone everywhere, even below the sinuses. There's probably 12 millimeters of bone. And one of the travesties of all-on-4 is that when patients go in for treatment into an all-on-4 center with bone like this, so much of it is removed. I think you've seen in my videos that it's somewhere between 10 and 18 millimeters that they cut from each arch. As a reminder, they do that to turn every patient into the same patient so that they can do these surgeries very quickly and do as many as 4 of them in one day. We schedule 1 a day. That's all I can do. It takes me much longer to do the surgeries without bone removal, more implants, and more finesse. Even though there was great bone volume, the bone density wasn't great, so the implants that went in were not as tight as they need to be to hold the first temporary. So again, going back to that transitional protocol that I've developed, we left 4 teeth behind, placed, I can't tell you without seeing the x-ray how many implants we placed, but we placed multiple implants. And I've also come up with a bone grafting technique for the teeth that don't, the sockets that don't get implants. I've found a material that stays in the socket. They say forever. I'm sure it's not there forever, but when we take a tooth out and don't put an implant in, that socket collapses by 30 to 50%. So I started grafting, especially the front sockets, with this, it's called hydroxyapatite paste, but it's a material that the body doesn't resorb, and that keeps that socket thicker than it would have been if we hadn't done anything. So sometimes I leave the roots behind, sometimes I do this grafting material, but especially in the front of the mouth, we lose 30 to 50% of that socket volume, and it just creates a little bit of a divot in some patients 6 months later that I never liked. So this is how we try to combat this. So there's a lot of talking points in this slide right here, but suffice it to say that we took out the majority of the teeth, put in the majority of the implants, and she's going to wear a temporary on her teeth for 3 months while those implants tighten up in the bone at a microscopic level. Here's the first temporary that goes in on the teeth. This is day of surgery. And again, I'd like to brag a little bit about the soft tissues and how careful I was with the surgery and how careful Dr. Tan was with the temporary, that it barely looks like anything happened this day. But as we go back over it, I took out 8 teeth, I put in probably 6 implants, prepared the other teeth for crowns if they didn't already have crowns, and did a bone graft, and the tissues still look this nice. This is 3 months later. Healing was very good for her. So this is the x-ray that shows how many implants I placed, which were 6 the first surgery, and we left those 4 teeth while doing that one front bone graft. So now we take out the remaining teeth. I added 2 more implants, And those implants weren't strong enough to hold the temporary, but I have the first 6 implants that are strong enough, so we use those for the second temporary. Here's the second temporary. And here's her final restoration. Oh, I'm sorry, this is her third temporary. Dr. Tan's temporaries are so beautiful, sometimes I confuse them with the final restorations. But this is her third temporary, and sometimes we do an additional temporary if we don't like the first one. And we didn't like that first one, so he made a third temporary, and this is what it looks like. So beautiful, I thought it was the permanent one. Here is her final restorations in zirconia, and you can see we've started her lower in the meantime. Here's her lower temporary on the day of surgery. Temporary delivered on the day of surgery. And again, I'll go back and I'll reiterate, if I'm wearing you out, I'm sorry, but this is amazing stuff. This is the day that we took out 10 teeth, placed 8 implants, and this is her temporary 4 or 5 hours later. Pretty amazing stuff. Here's her upper permanent restoration with the convex contours that are so important for cleansability. And here's the way her tissues turned out. She's been wearing that temporary now for probably 6 months while her lower healed. And here are her final restorations. A little bit of impression material on that left side, or on the right side of the slide. I apologize for that. But that's those are the tissues that everyone deserves. If you have the majority of your teeth left and you've got great bone, there is no reason to have pink zirconia. If you end up going to an all-on-4 office, you're going to have an FP3, which is bone removal and pink zirconia every time. There is no other option. So a patient like this that would wander into an all-on-4 center, her smile may look similar, but as I always tell you, with the lips retracted, the foundation is her foundation. It's not pink zirconia. These are a little bit out of order. This is her lower prosthesis with the same convex contour so that she can clean it herself. We don't have to take it out twice a year to clean it for her. And there's her lower tissues. And again, here's her final, after she's worn her upper for several months. I believe this is day of delivery for her lower. So there's her radiograph. You'll see only slightly angled implants for anatomical reasons, but I try to do parallel implants everywhere for the best possible outcome and contours. Another great before and after picture. Because we did her arches separated, it took us 15 months. She was here 7 times. She never broke her temporary, which is always amazing. And she was local, so she may have had a follow-up visit or 2, but 7 or 8 visits maximum. And it could have been done, her treatment could have been done in 7 months, and she could have come 4 times had we done both arches at the same time. Moving on to case 15. And just to show you that we don't always get patients that have all their teeth and all their bone, but depending on your particular genetics, you may still have bone in the areas that you don't have teeth. But here's a great case that we didn't have 6 of the upper front teeth, and a lot of the bone had resorbed up there. But we were still able to give her an FP1 or an implant bridge because she had the vertical bone. She just didn't have great bone thickness. And her soft tissues are robust and good volume of this nice connective tissue called gingiva. Here's her preoperative panoramic radiograph. And like I said earlier, the bone volume is generally good, like it is for most patients. I show this picture, especially when we do different implantation techniques. I had almost every kit out that I needed to be able to do this case. Some of these drills are for drilling in a manner where we don't remove bone. It's a technique where the special shaped drill is run in reverse, and it opens up the bone for an implant site without removing bone. So it's not a subtractive drilling method like when you're doing woodworking and you drill into wood and sawdust comes out. That's a subtractive drilling method. When you use these special burrs in reverse, you're burnishing bone and not creating any bone dust, if you will. So it's not a subtractive drilling process. And then the other kit with the red is one that we use below the sinus to enter the sinus carefully so that we can add bone ahead of the implant. So again, back to the reason that these cases are more expensive is that there's a whole lot more that goes into the planning and the surgery and the prosthetics. And I think by now that should be obvious to you, even though you don't know what happens in an all-on-4 procedure. I do talk about that in a lot of my videos. So I just took a picture of the surgical table on this particular day because we had every drilling kit out that I own. So she was fortunate. We were able to get one implant in the front, and she had her implant supported temporary on the first surgery. We used 6 of the 7 implants that day. Here's her temporary on the day of surgery, and as always, minimal tissue and bone trauma. And there she is 2 weeks later. Here's her definitive implant bridge, or FP1, all convex, easily cleaned. Here were the tissues that were developed over the previous 3 months. And again, remember, this lady had no teeth in the front. And look at how much tissue volume. I didn't add any bone here. I just used special drilling techniques that spared the bone. But you would never guess that this patient did not have all of her teeth when we started. And there's her final restoration. And we start on her lower after her upper is finished. So these are financial decisions for most patients where they want to pay for one arch and get it finished, and then they have the luxury of time. If their lower teeth are reasonably good and they're not in any pain, they've got the luxury of time to save a little more money and come back for the opposite arch. And we always pick the arch that is the most dire or the most in need of treatment. We start with that one. We try to make it the upper because that's where all the joy is, getting new beautiful upper teeth. So I'd say 90% of the time we start with the upper, but not always. Again, this is her lower temporary, beautifully contoured by Dr. Tan. Here it is on the day of surgery, another picture of minimally invasive treatment. 6 lower implants. Here's her lower definitive restoration with those convex contours. Here's the tissue development that we had over the prior 3 months. And here are her final restorations on the lower. Upper's been in there now for probably 4 to 5 months, and you can see how beautiful it's healed. Her final panoramic image. Before and after. How's that for life-changing? Because of the extended financial terms, she was 18 months in treatment 8 visits, and she was local. Case 16. Here's a case with a patient that didn't have all that great a bone. The sinuses have dropped down on both sides, and this patient has maybe 8 or 9 teeth left in the front of the mouth. And that surprisingly is enough for most patients. Unless you have to have your second molars, if we can stop at your first molars, which is 12 teeth, it's usually a lot more than people come in with, but we can avoid some bone grafting by not putting the second molars in there in a case like this. So we took out the teeth and we put in 5 implants this particular day, and this is the temporary. This is the temporary on the day of surgery. Again, I'm going to brag about the tissues on the day of surgery and how well adapted the temporary is to the tissues. Here he is 3 months later. Here's his definitive or his permanent implant bridge, the FP1. And look at these tissues. I mean, it is just remarkable. And if I didn't take all these pictures, I probably wouldn't be as impressed as I am. But I think you've probably heard me say in my other videos that in my 36 years of being a dentist, I've taken about 3 million pictures of my treatments. And I'm so glad I have, because it tells a story that I couldn't tell through memory, that's for sure. So there's his final restoration. I mean, again, I'd like to say as good as we've ever, or the best we've ever done, but this is just what we do on a weekly basis. Here's his final panoramic, and yes, my staff is in trouble right now for the quality of these panoramics. No excuse for not having perfect x-rays. So we are in a training phase right now. He was from San Antonio, so he had about a 5-hour drive, but he came, it took us 5 months. He was here for 5 appointments and 4 total trips to Dallas. Case 17. Here's a patient who came in with just 1 remaining tooth. So again, I'll go back to my competitors, the all-on-4 doctors. They'd look at a patient like this and say, oh, all-on-4 is going to be perfect for you. And I would look at it and go, well, let's look at your x-rays. Let's look at your CT scan. If you're lucky, and most of our patients are, you have more bone than they will tell you, and you will qualify, you likely will qualify for an FP1 or an implant bridge. So surprisingly, on the panoramic image, there is more bone than you would expect. Even in the upper, on the left side of this slide is the patient's upper right. He or she, I don't remember who this patient is, but there's more bone over there than I would expect, and we can certainly use that with that red kit that I showed you on the previous treatment. It's made to enter the sinuses gently so that we can add bone ahead of the implants. So this patient was able to get implants, enough implants to hold the temporary the first day. So the very back implant where I added bone, we did not use that for the temporary on either side, but we have the middle 5 implants that can hold a beautiful temporary. That's what the temporary looks like on the day of surgery. We must have had a traumatic extraction or something on that, on the right side, which is the patient's left, because you can see the suture there. But nonetheless, with tissues that are not traumatized and tissues that are healthy, you'll be amazed at the way it heals. So here that patient is 3 months later, and you can see all of that side has come back. A little bit of redness around that left lateral incisor, but the tissues look beautiful. Here's the final implant bridge. We ended up using 7 implants. And this is the way the tissues look on the day of delivery. As you'll recall, she had no teeth in the front, but the tissues were still pretty good, and we can recontour those or shape them with the final restoration to look like the teeth are growing out of the gums. So this case is a lot more complex than people with all their front teeth or some of their front teeth, but the outcome is the same for all the reasons that I've been talking about for 5 years. And the final panoramic x-ray. You can see on that both the back implants, but especially the one on the right side of your screen, you can see where I added the bone. We now have bone over the top of that implant. So another perfect case of where the all-on-4 doctors would have never used the backbone that was available, and they would have removed 10 millimeters of the front bone, and the patient would have had a big, huge bumper of pink zirconia afterwards that was completely uncleansable. We now have an outcome where the patient can clean everything themselves. Brushing and water picking is what most of my patients do. They don't even floss. But look at this x-ray and look at the contours that are all convex, and that's why they're so easily cleaned. Most of our patients with bad teeth, we cannot get them to smile naturally or at all on the preoperative visits, and they're better smilers afterwards. She was local, 5 months, 5 appointments. Case 18. Here's a lady that came in with some good teeth, but many failing teeth, and you'll see on the x-ray that her teeth are a lot worse radiographically than they look clinically. And if you look at the left side of the screen, which is her lower right, she had some, what I have to assume were highly traumatic extractions there, and she's basically lost all of her dental bone. So we couldn't do implants there, and that's a really hard place to do bone grafting. So she got a long, thick bridge down there, and we're hoping that those teeth last for many years to come, but that was a tough area to treat because of all the bone loss. So here's her panoramic image, and you can see that she's got root canals, which we call endodontically treated teeth, and her upper left side, which is the right side of this picture, all those teeth on that side are infected. So when you start to count the number of good teeth, you get down to a number where I consider it the tipping point, where if she wanted to save any teeth, I would, but the question that I that I present to these patients, like I said in the first part of this series, is that if you can afford to do this multiple times, 2 or more times, will save all the teeth that you want to save. If you're basically in a financial position where you're trying to do this one time for the rest of your life, then we take teeth out based on finances. And that may seem, I don't know if that seems unethical or not, but it's the patient's ultimate decision. But the way I ask the question is, if you're a person of means and you can save teeth and replace them in the future, you can spend tens of thousands of dollars a couple times, well then great, we'll save every tooth you want to save. But if this is a one-shot deal for you, where you want the best you can get now for the money you have, then we should sacrifice some good teeth to prevent future problems. And a lot of my colleagues would criticize that statement, saying, well, you can never predict the future, you can never predict the future. And of course I can't, but I've been doing these treatments, and I'm following up some of those patients from 3 decades ago, and their status hasn't changed. So I do feel confident that when the surgery goes well and the patient cleans their mouth well, that these are forever treatments. So she got the first surgery was part teeth and part implants, which is another it's another part of the protocol I've developed, is that we can connect teeth and implants in temporaries. We do not do that in the permanents, but it gives us an opportunity to make somebody a really nice, almost full arch temporary by combining teeth and implants. So you can see on her right side, those implants were not strong enough to hold a temporary, so we left 2 of her teeth behind. So we have 2 teeth on the right, and then the remaining 5 implants holding her first temporary. Then the next surgery, we can use those implants that we couldn't use the first time. So this is her second temporary, but look at the tissue response to the second temporary. It is amazing to me what the human body can do as far as healing goes. Here's her upper permanent restoration. And again, I want to show you the tissue development or the tissue maintenance that we did for her was amazing. Final restoration in place. She may have picked a color that is a little bit too white, but I know all of you are thinking I'd rather go too white than too dark. So, and look at all the bone and look at all the nice implants that are well surrounded by bone. Before and after picture. Now, she had a pretty nice smile beforehand. Her teeth were just failing at a fairly slow rate. Some were ready to be taken out, some weren't, but nice outcome for her. Very nice outcome. She was not local, but we did all this in 8 months, 5 appointments, 4 trips to Dallas. Case 19. So the first thing I look at is when people come in with all their teeth or almost all their teeth is how much bone is around the tooth, each tooth, and how good is the connective tissue. And the answer to the question for this patient is outstanding. She's got outstanding tissue, outstanding bone, failing teeth. So again, I'm just going to say, reiterate to try to scare you all into not doing it, but this patient goes into an all-on-4 center. She's coming out with 15 millimeters of her bone missing on the upper, a big pink zirconium bumper on her prosthesis, which would be called an FP3, when she deserves the option of getting an FP1. So I'm glad she found me first. So she already had 4 implants in the upper. This is another important point about all-on-4. Because they remove so much bone to do all-on-4, they always take your existing implants out. And if your implants are in a good position, like hers are, whoever did this surgery for her did well, we can use these implants with an FP1. There's no reason to take them out. Like so many of our other patients, the first implants did not go in extremely tight, so we left teeth behind. She left here with her first temporary on teeth. Notice how nice the tissues still are. She comes back 3 months later. We take the remaining teeth out, we place more implants, and she leaves here with her second temporary. Some of those implants were still not strong enough, so she, like I said on the last patient, she leaves here with her temporary on some teeth and 2 implants. This is the way the x-ray looks. Her second surgery, again, this is the day of surgery, minimally invasive. Here she is 3 months later, ready for her third surgery. And we do that, we take out any remaining teeth and we put more implants in. And now I'm skipping forward to her wax try-in. People always want to know, how do we know how to make the teeth? Well, we take advice from the patients. We ask them for close-up pictures of their best smile. Maybe high school graduation would be that picture. But any smile that you like, we try to mimic the tooth shape of that smile. So after she wears the temporary, she's had 3 sets of temporaries now. So she's had 3 renditions that she's been able to critique and see in the privacy of her own home, the mirror in her car, selfies, whatever. Most patients have an idea of what they might like to change or not. Dr. Tan's temporaries are so amazing that most people love those, and we try to mimic the temporaries. But we still go through a process called a wax try-in, where the lab gives us teeth in wax to put in the patient's mouth so that we can see it in real time. Sometimes we don't get it right, and in this patient's case, the teeth came back too long. So that's why we do the wax try-in, because the wax try-in is the prototype for the zirconia. The zirconia is going to be the exact size and shape of this wax. So we all agreed that the teeth were too long. So we simply take a marker and we mark out how much of the tooth we think is too long, and that dark shadow or that marker disappears when you're here. It lights up with the flash, but without a flash from the camera, it disappears in the mouth, so we can actually decide how much the lab needs to take off. So we convey that back to them, and if there's any doubt at all, we do a second wax try-in. This is inconvenient for the out-of-town patients, but again, we're talking about tens of thousands of dollars and a smile that you're going to probably have the rest of your life. So if it requires another trip to Dallas, it requires another trip to Dallas. But we have such a good relationship with our lab that they will usually fix these the same day or overnight, and we try the new setup in the next day. Sometimes when it's only a matter of shortening the teeth and everybody likes the shape, sometimes we don't even have to do a second try-in, because that black mark that disappears in the mouth gives us exactly the length that we're looking for. We did a second try-in on her. We ended up with this as her final restoration. She ended up with 8 implants, 4 that she already had and 4 that I placed. But again, I want to brag about the tissues, just how beautifully sculpted these are by Dr. Tan's temporaries. A different view of these amazing tissues. And those are her final teeth on the day of delivery. Final x-ray. She's saving up for her lower arch, but her lower arch is in good enough shape that she has the luxury of time. Before and after smiles. Moving on to case number 20. This gentleman is a former employee of mine in another business, and he's now a police officer here in a suburb of Dallas, and he had bad tooth genetics. That's what he told me, and then he proved it to me when he became a patient, and we decided that for a variety of reasons that he was going to get his full mouth restored with implants. And he has pretty good bone and pretty good and quite good gingival tissues. He does have a very large infection. There's a little dot, or a little red area with a dot in it on the right front of the screen, and that is a very large infection there. So we had to do his treatment in multiple stages. You can see on his preoperative radiograph. The interesting thing on his CT scan was that where he was missing teeth, he had virtually no bone. So we had to be very selective in where we were going to place his implants to maximize the distance. We call it anterior-posterior spread, how far apart I can separate the implants for stability of the bridge. So like I said, we did his treatment in multiple stages. And I think this next slide is pretty bloody, so you may want to skip over it fast. I'm sorry about that, but there's things I want to talk about in this picture. We did his treatment in segments. So what I did was I took out most of his teeth and I placed whatever implants I could that day. Where he had the infection, I did a bone graft and I covered it up with a membrane. This is a removable membrane. And then we made him a fixed temporary that went in that day. It's a beautiful temporary. Doesn't quite fit the tissues like I wished it did, but we still got away with it. So he comes back in about a month, and we remove the membrane that's in the area where the tissues aren't very good. And I like this picture because it shows we can as long as we're handling tissues properly and atraumatically, how much they can recover. So that membrane did its job, and we took the membrane out, and all this additional connective tissue healed where he had the infection and where I did the bone graft. We placed additional implants that day. Got a different temporary that day. So you can see the tissues now continuing to develop His final upper restoration looks like this, like so many of the others. His lower was a different material, and I have a lecture on that as well. For men, I almost always do titanium with polymethyl methacrylate on the lower, and half the women we do the same, because I don't like zirconium against zirconium in most patients. Only in patients I know that don't grind or clench, have really small facial muscles, will we do zirconium against zirconium. So this is the lower titanium acrylic prosthesis. But look at his tissues after so many surgeries, bone grafting and everything else. They've recovered beautifully. Any place you see red is where he had a slight allergy to the acrylic resin, or sometimes we modify tissues before we put the permanent restoration in so that the recipient site is perfect for the fake tooth called the ponic. And you'll see here how beautiful this turned out. But mainly that area to the right side of center that was really badly infected, we got a nice implant in there and the tissues came back beautifully. So there's his final restoration, and he's very happy with it. Final panoramic x-ray. Final smile picture. So I'd like to thank you again for taking the time to watch this. I know my videos are long, and I know I probably ramble a little bit, but from your feedback, we appreciate the feedback, and I'm glad that all of you like the educational component, even though I go for so long. Thank you, and look forward to the last segment of this series, which will be 5 additional cases like these.